Good morning, everyone. I want to take this moment to welcome everybody to the COVID-19 Coordinator webinar, sponsored by Go for Ellis. I'm going to give everybody about another minute to get settled, and then we'll get started. Thank you. Okay. Good morning, everyone. My name is Andy Hayes. I'm here with Ellis Mayer. We are part of the Go for Ellis team. And today we're going to talk about a new position that has becoming more and more available on the Go for Ellis platform as we all try to deal with the reopening of specifically sports and COVID-19. And we're going to talk about the roles, the responsibilities, and the interaction between the event operators and the athletic trainers that need to happen in order to make this a reality. First off, a little background. This is our third in a webinar series. We have previously done one on insurance and liability with John Sadler from Sadler Sports. Ellis and I did one the last week on how to open or reopen as a sports organization for camps. And a little background, in my former life, I was a founder and CEO of Next Sports, which is one of the largest lacrosse sports operators, events, club teams in the country. I am now the CEO of Go for Ellis, and I am actually joined by V. Ellis, who is the Chief Medical Officer at Go for Ellis, and in her former life, she was the Director of Health and Participant Safety at Next Sports. She's been an athletic trainer at Penn State, Boston University, and Monsignor Bonner High School. She is in charge of the NATA's Youth Sports Task Force, and frankly, she is our expert on all things around youth sports and safety. So to start, I want to talk about what our objectives are today. These are very important. The first one is to define the role and responsibilities of an AT COVID coordinator. Then we're going to talk about, as an event operator, how do we hire and accept an athletic trainer for this position? And then lastly, we want to establish how event operators and athletic trainers can work together to develop and execute COVID transmission mitigation plans and protocols. The two previous webinars, we really dove in on what some of those mitigation strategies and plans are. And so I strongly suggest that you take a look at those after we're finished today. So first and foremost, Ellis and I want to make sure that everybody understands that the priority is the lead of authority sources, and you need to monitor government health agencies, the U.S. Center for the CDC, your state's public health department, other county and local authorities. We'll tell you that your state and local and county authorities should be the ones that you primarily focus on. The CDC published the Considerations for Youth Sports on May 19th, which is this 68-page document that is very expansive, and we strongly suggest that you monitor websites, emails, and social media from sports governing and sanctioning bodies that oversee your sport. As we talk more through this, you'll see kind of why the state and county and local authorities are the ones that event operators and athletic trainers really want to pay attention to. So to start, I want to ask Ellis, what is the role of the COVID coordinator?
Thanks, Andy. Thank you, everybody, for joining us today. So a COVID coordinator is very much a new position. So we have seen that as sports are starting to return, there's a lot of questions about how we do this. And so it's a perfect time to have athletic trainers involved and in the room with our event operators, especially in the youth sports realms, to help them do this safely. Athletic trainers, we're very well versed in injury and illness evaluation, and we're very good at pre-event planning and pre-event emergency planning. So we are truly the perfect allied healthcare professional to step in and help some of our event operators navigate through this difficult situation. So as we know, everybody on this webinar knows rules and guidelines and things are changing every day. So it's really a top-down approach. The CDC has recommendations, then your state has recommendations, then your county might have different recommendations, then the next county over. The city might have different recommendations. There might be recommendations that you have to follow per venue. NGB is specific to your sport, might also have recommendations. So it can be a very arduous task to navigate all of these things. There are different rules for camps versus tournaments versus practices. So there's a lot of reading and digesting and discussion to be done. And we believe that athletic trainers are the perfect person to step in this moment and help our event operators and help them guide them through all of this, all of the different recommendations that are out there.
Yeah, and in my former life as an event operator and camp director and club team coordinator, we always broke things into three parts: pre-event, during the event, and post-event. And I think one of the things that we're going to hopefully deliver to everybody today is the types of things that a COVID coordinator can help an event operator deal with in a pre-event scenario, but also athletic trainers, and we have a lot of them joining us today. You know, these are the types of things that Ellis would have been doing when we both worked at Next together. And so the pre-event stuff, you know, the big thing here is you got to prepare. And so Ellis, can you take us through the pre-event and what you would be doing? Obviously, these are generalizations, but maybe you can dive in on some specifics on how some of these things are going to happen.
Yeah, absolutely. So I think it really depends on what the deliverables are and what's expected from the EO. So what does the event operator need? So we really need to go through that needs assessment. All right, so what's our end goal and what is the date of the event? Are we doing a returning to club sports practice? Are we doing a camp, a day camp? Is it an overnight camp? Where is it? And really kind of going through the process of what's involved in each one of those things. So first of all, you really want to figure out what is needed of the event operator, and then going through the regulations and the guidelines that are already out there for those specific types of events. So, and then once you work with the event operator, the other thing you can do is really looking at the sport-specific risks and how you can mitigate some of those risks and address them. So maybe you're changing some of the rules, or you're helping change the flow of how things go, like whether it's drop-off or pickup or things like that. So really you want to do this risk assessment and do a whole contact audit and go through with the event operator. And this should be, the pre-event phase really should be the largest, most time-consuming phase. So this is where all of your planning goes through. This is a really collaborative effort that you need to do. So you're going to have to revise and work and poke holes and keep working at this together. And you really want to be able to be flexible and be able to adjust in a moment's notice, because tomorrow it might be a completely different set of guidelines that come out because the county color changed, whatever, if you want red to green or whatever the moments are, things are changing at a moment's notice. And really staying on top of what those best practices are very important. So this is where you're going to be doing a lot of documentation, a lot of drafting, redrafting, and a lot of communication. So you want to make sure that you create what you want to call your COVID plan, and then you want to shop that around to all of the stakeholders. So just because you and your event operator might have a really good idea of, like, you know, we're done. Andy and I nailed it. We think that we've got everything we need to do. We're up to date on all the county regulations and whatnot. And then we send it off to our coaches, and some of our coaches have an issue or have some questions about that. Or maybe if it's a tournament, maybe the referees are concerned and we were like, oh shoot, we didn't think about referees. Maybe we shop it around to more of the athletic trainers and they're bringing up some concerns or have some other ideas. So this is really a multi-stakeholder conversation. You and the event operator can help put together the drafts and the ideas of what the plan are. And then you really want to involve all of the stakeholders, club directors. If maybe club directors aren't pleased because they're not quite ready to enter that form of competition, or whether it's a school and maybe maybe you had a plan to use a certain venue, but the school doesn't really want anybody on campus at the moment, or they're not allowing people in the cafeteria. So, or when there's lightning plan, you can't really go into the shelter that you originally thought you could. So you really need to start this phase weeks in advance. So you want to review everything, develop your plans, and just be ready to edit and redraft and work together and really involve as many stakeholders as possible, parents, coaches, club directors, in these conversations, so you can really get everybody on board and make sure everybody's comfortable with the situation that's about to be going on.
Yeah, and just from the EL perspective, to all the event operators out there, this is not something that is going to be handled on the day of the event as part of an athletic trainer's per diem shift rate. Like, these are things that take place ahead of time. And so as you're putting together your safety protocols and thinking about how best to handle this, you really should be thinking about engaging an athletic trainer. And just if people don't know, they are medical professionals and they are trained in this entire situation. And I will tell you that if I was running an event, a club practice, or things like that, I would be engaging an an athletic trainer in both clinical and non-clinical. And non-clinical is they're going to need to take some time to help you put some of these things in place. And so it's very, very important that we all understand that athletic trainers have a unique skill set. And in this, as we try to reopen the country in sports, they are going to be very important to this happening in a safe manner.
Yeah, so, exactly, Andy. Pre-event emergency planning and prevention is our number one goal always. Let's prevent injury. Let's prevent illness. Let's try and make it so the day of, it's smooth sailing and everything's been communicated appropriately and everybody knows what the expectations are.
Yeah, and I think, like, again, this is from an event operator perspective. You need to have these protocols in place. And I strongly urge you to go back and watch our webinar with Sadler Sports, where John specifically talks about, as one of the largest insurance brokers in the country for sports and recreation organizations, he really lays out some of the things that you need to be aware of from an insurance and liability. And one of the primary things is do you have a plan and are you following it? So I think some of these protocols that we've listed here, again, we can't get them all. They're all unique to every venue, every county, every event operator. But, what happens if someone's presenting the COVID-19 symptoms? Where will they be isolated? What is the protocol for transportation? The number 3, what is the documentation? What is the follow-up procedure? What is the communication pathway if there's a confirmed positive case? And Ellis, can you please talk about the last one, which is probably the most important one here?
Absolutely. So HIPAA compliance is a huge thing with COVID-19 and cases right now. So if there is a potential or a confirmed positive COVID-19 case, it needs to be handled in a HIPAA compliant way. So we can't just write the camp and say, oh, Andy came to practice the other day and he's now diagnosed with COVID-19. Your child was in Andy's group. He may have been exposed. So you need to make sure that we're not sharing those making sure we don't share any patient sensitive information, such as name, date of birth, anything like that. And athletic trainers, we are very well versed in HIPAA and trained in HIPAA and know what HIPAA violations are. So we can really help you understand how to best communicate that to all of your participants. I think that's really all I have for that one. But yeah, that is one of the biggest things that the last part of the CDC is making sure that what if someone does get sick, what is that plan? And those are all those questions that you need to ask. Talking more about pre-event planning, I did just a practice intake form the other day for myself. If I were to be a COVID coordinator, what are all the things I would ask an event operator? I think I came up with 145 questions or something close to that. That's me. I have a lot of questions. I want to make sure I can poke holes in every single thing as possible in all my what if scenarios. I didn't actually do that by myself too. I called somebody who was a former event operator and I said, here's my list. What else? Because she had the experience of the event operator, venue specific things. So vendors, concessions, lightning policies, things like that, where she brought a different perspective, and we were able to really create this whole list of questions of we should probably have all the 145 questions of this answered before we even think about rolling ball out on the field.
Yeah, no, that's really important. And I think one of the things that Ellis referenced, and I can't stress this enough, and I'm now putting on my previous event operator hat, you really should start with, before you even get to questions as an event operator, who are all the stakeholders? Who is all involved in this event that I'm about to put on? And Ellis mentioned referees. We know of some events where referees have said, hey, we're not going to be involved here because we don't know what the protocol is. And so you really need to be ahead of this. And I think even before, I'm not the medical person, so Ellis has 145 questions. I, as the event operator, would be coming up with, all right, who are all the people who can or will be involved in this event? And it's down to the people who are responsible for, cleaning bathrooms and, sanitizer, all of these things. It's just, this is a whole new level of event execution that people need to be prepared for. And athletic trainers are uniquely positioned to help event operators pull this off so that you can focus on the experience for your customers and your clients, and the athletic trainers can do what they are been trained to do, which is to create a safe environment and handle emergency situations. So pre-event, can't stress this enough. You got to spend a lot of time on this. So the big one is during the event. Well, in theory, if everything in pre-event went well, you should have everything in the event should go smoothly with no issues whatsoever. However, we all know that that's not what happens. All right, during an event, something has changed, something's different, but you got to have a plan to start with to deviate from. So during an event, you got to actually execute and manage the COVID-19 transmission mitigation plan that you and the medical professional, hopefully an athletic trainer, put together. You need to, and this is where I think as an event operator, you need to stress, encouraging social distancing, encourage proper use of PPE. Do you need masks? Do you not need masks? What are those regulations? Encouraging good hygiene, such as hand washing or use of hand sanitizer. Overseeing supplies. I'm not suggesting that athletic trainers are going to be the ones that are, putting supplies out and things like that. But as a COVID coordinator, they can help you manage some of these other things that are really important. And again, I can't stress this enough. You have to execute and administer the protocols for suspected COVID-19 cases that you and the athletic trainer, who is my guess, managing this event for you, have come up with ahead of time. Can't stress this enough. Ellis, anything to add to this?
Yeah, one of the things on my list of a million questions was I think I had about 15 different types of signs you could have too. So encouraging social distancing, making sure, reminders to wear your mask. The CDC actually has several printable, so you can just print off signs about social distancing, about masks, things like that. Some nice resources that they have right on their website. If you think about a venue map and how drop off, or if people are going to be walking their kids to practice or to the camp, thinking about the same kind of approach a lot of grocery stores are doing, are a one-way traffic approach. So directional signage of, you park your car here, you get out, you're going to walk your kid down this hallway. If there's a temperature screening checkpoint, things like that, like maps, directional signage, reminders. So think about the visual cueing that you can do to help your participants understand the rules and the expectations of them being there, as well with the verbal cueing. So reminding them, you just make sure your mask covers up your nose, making sure, hey, there's hand sanitizer stations over here if you need them. So just kind of the visual and verbal cueing of signage could be very helpful during events.
Yeah, and I think as you can see, Elsa and I have been working together for a very long time, and as an athletic trainer and event operator. And with the next section here, we wanted to really hone in on for event operators and then for athletic trainers. But we want the event operators and the athletic trainers to see the other stakeholders list. And the reason for that simply is that Ellis and I feel very, very strongly that this is a team effort, right? We're all trying to get back on the field. We're all trying to get sports and to get customers and clients back in a safe way. And so it's really important that the athletic trainer and the event operator are working hand in hand on this. Can't stress this enough. So I want to focus on what does an event operator need to start thinking about in a pre, during, and post event. And I'm going to kind of walk through this. So the first one is the job listing. What do you need from a COVID coordinator? You know, do you need pre-event help in reviewing state and local regulations, drafting communications, et cetera? All those things on that list, right? That is something that athletic trainers do in their full-time jobs, in their regular jobs. This is what they do. The big one, and this is just as it relates to fairness and athletic trainers' time and effort, it's like, what's the time commitment? You know, I like to think of things as clinical and non-clinical. And if you don't know what that means, an athletic trainer in a clinical setting is where they're seeing patients potentially. So that would probably be at an event, a camp, a tournament. And non-clinical is where they might be putting together for you what the local and state regulations are. And you really, as an event operator, I know if I was trying to hire Ellis as a COVID coordinator, I would be defining the time commitment. And frankly, as an event operator, we probably have no idea how long it's going to take Ellis to look up every regulation and answer all 145 questions. So you need to be willing to commit to this as it relates to the safety of your event, your customers, and all of the stakeholders. And the last one is like, you get to define the expectations for the athletic trainer. Maybe you need someone just to do all the pre-event stuff for you, but you have people on the grounds that'll help you, right? Are they expected to handle athletic injuries during the event in addition to the responsibilities of COVID coordinator? I will tell you right now, if this was my event or my camp, I would be having a COVID coordinator or the COVID coordinator role would be part of their job on the day of the event. But I would need more athletic trainers underneath that person to help execute on these mitigation plans and strategies that we've come up with, on top of tending to injuries, illnesses, things that may happen during the event. So whether you use Go for Ellis or not to find these athletic trainers is irrelevant. I'm telling you, as a longtime event operator, it is imperative that you get in touch with a medical professional in order to best put on your event in a safe manner. So, specific questions I came up with. Do you need help reviewing national, state, and local regulations? Do you need help reviewing venue regulations? Do you need help with policy development? Do you need help creating pre-event self-assessment checklists? Do you need help reviewing pre-event communication? I will tell you that the more you communicate with your event, with your parents and participants and coaches and referees and all of these things, all of these people that are involved here, the better the event's going to be. And I will also tell you from experience, when you tell them that you have a COVID coordinator or you have an Ellis who's helping you put all this together, there is a sense of relief that, wow, they've really thought about this. And so it's really important that you address these questions and really answer for yourself on what you need. Big one here, you know, this is, and I'm going to let Ellis jump in on this, but we're talking about PPE here. Like, what are you supplying? You know, and this is where the local and state regulations, like a county in Alabama has a way different rule around masks than, say, in Westchester, New York right now, as it relates to youth sports. So, Ellis, can you talk a little bit about pre-event and supplies and PPE? Because obviously, it's not like you can just go find this stuff on the shelf.
Yep. Again, this is pre-event. Finding a lot of these supplies right now, one, it's expensive, and two, it can be very hard to do. So this should be one of the first items on your checklist of, we're going to need hand sanitizer. We're going to need a couple extra masks. Obviously, are you going to provide 3,000 masks for everybody at a tournament? No, you're probably going to encourage other people to bring their own masks and bring their own cloth-based masks. However, what if the patient doesn't have a mask or lost a mask and now they're exhibiting symptoms? You might want to have some extra on hand so you can provide that with the patient, be able to isolate them while the athletic trainer does the evaluation. Extra gloves, face shields are a big one, or potentially making a plexiglass screen. So depending upon what your screening protocols are going to be for your event, if you're doing a temperature screening, depending on what type of temperature or what type of thermometer you'll be using, you might have a different setup, which might require a little bit more PPE. Hand sanitizer, washing stations, you absolutely want to encourage good hygiene in all of your events. And having some extra of those things is always going to be a good thing. Signage, like I said earlier, I cannot stress enough the importance of signage. It's just a really easy way to help communicate, very clear signage to help people understand. And think about if you can read a sign as opposed to walking up to a tent and having that interaction with a human, that's just increasing more social distancing right there. So a lot of that visual and verbal signage is going to be it's going to be very important.
Yeah, that's great. Thank you. And, just for during the event, again, Alice can't say signage enough. I mean, this is really important. You got to let people know that by coming to this event, you have to take extra precaution here. And so signage, and I think Alice referenced the CDC has signage that's available for download. Obviously, you can make your own. It's not hard. But making people aware of where hand sanitizing stations are, where's the medical tent, social distancing. Like if you're running a tournament, you need to have these signs on every field. Extra masks for participants that may be exhibiting symptoms. We'll talk about that a little bit more a little bit later. And we got to have a defined area where the participants presenting COVID symptoms can be isolated before they're either sent home or transferred to a hospital. I know this sounds like a lot, but this is what you need to be prepared for. And again, I stress that you go back and listen to John Sadler, the insurance expert, on some of these things. And as long as you are putting a plan together and executing on your plan, typically it's going to be very, very hard for you to get in trouble for that. So please go back and watch that webinar, and you got to have a plan. All right, for event operators, this is the big question. And this right here is why as an event operator, I would need to have Ellis, okay? Because I don't know what I would do here. So Ellis, what happens if there was a confirmed positive COVID case at your event, or forget even confirmed? What if someone is exhibiting symptoms?
Yeah, I mean, exhibiting symptoms, again, it's just like any other patient evaluation that an athletic trainer does. So you're going to be doing your screening questions, asking if they've been exposed to anybody recently with COVID. Have they been out of the country or traveling recently? And going through the symptom checklist with them. So you're going to be doing kind of your normal evaluation that you would be doing on any sort of illness. And then if you are suspicious that they potentially could be a positive case, you need to be able to be prepared to be able to handle that. So isolating that patient, not putting them in a tent that says, this is the COVID potential positive tent, because again, that's a HIPAA violation. So making sure you're discreet about the way you're treating this patient. And then what's the plan for transport? So is their parent there? Is it a parent? Are they able to drive themselves and take themselves home and make an appointment with their physician? Are they in a condition where they maybe need to be transported to the hospital? If they need to be transported to the hospital and you have to call 911, make sure you're telling the EMS crew what to expect when they come back. So they need to know that they're coming and they are transporting a potential positive patient, COVID positive patient. So they're ready with their protective PPE, and they understand what the patient signs and symptoms that they're exhibiting. So they're ready for that scenario as well. So again, communication is going to be a huge thing here. And if you do hear back that there's a confirmed positive case, how are you going to communicate that to the rest of the campers or to the rest of the school? What is the plan that you and your athletic trainer have come up, or maybe it's your administration, have come up with ahead of time for how we handle these situations, so we let people know that, hey, they potentially could have been exposed at this event?
Yeah, so I'm going to take 1 second. I know people are asking a lot of questions. We're going to try to get to answer all of them. But one that just came in, which I think is totally relevant, we were asked, would we deny entry to those spectators who do not have PPE? So I'm going to give my event operator answer, and then I'll let Ellis give her medical opinion. As an event operator, you can't deny entry if you haven't told people ahead of time what the rules are. And local, county, and state regulations are probably going to have regulations and guidelines put in place. But you as an event operator, I will tell you, for me, I would be stressing that if you are not wearing PPE, you can't be on the field. You can't, excuse me, not as a participant, but watching. I just don't see why that's a positive thing. And on top of that, if they still refuse over and over again, we did talk about this with John Sadler too. You are allowed to, based on local and county rules, be able to call the police, and have them help you and back you up. So whatever your protocol and your rules are, you just have to back them up. And more importantly, you need to communicate them. And by the way, you can't communicate that on the morning of. You need to communicate that way ahead of time. You need to communicate it to the coaches, to the club directors, to all the campers, parents, everybody, so they're all on the same page. So that's for the event operators. The ATs have a whole nother set of issues that we need to talk through, and Ellis is going to guide us through this. And let's start with Ellis. As an athletic trainer, I see a COVID coordinator job, and either at Go for Ellis or somewhere else, and I apply. What do I need to know?
So I would my first thing is I would do, I'd reach out and I'd contact the event operator, and I would get all of the details and the expectations and have all of that laid out. So I'd get an idea of the scope of the project that we're looking at. So is it just a club team that wants to return to practice and they only have high school teams and there's 12 kids on each team? They have one giant field, and that's going to be a little bit different than planning potentially a tournament or a camp where it's smaller, younger children that might not be able to follow directions as well. So you're gonna have to take in take a different approach with maybe some of our younger patients. So I think that the first thing is to really contact the event operator ahead of time and say, hey, I'd love to hear more about the opportunity. When is the camp? What sport is it? What have you done already? How much do you know? Some of our event operators might be like, I don't know. I'm way out of my league. I need help. Help me. So you might actually be having to do a lot of work and reviewing a lot of policies and procedures and guidelines at all different, like we talked about, levels throughout the government and throughout the NGBs. So I'd contact them and get kind of an idea of the scope of work involved and have that conversation with them.
Yeah, and if you could continue on, Ellis, I know there's like specific things that listen, there are 145 of these obviously, but let's focus on these 5, and I'm sure they're going to address a lot of these things. But how would you handle these 5 sort of topics?
Yeah, I kind of take a top-down approach. So let's see what the CDC is saying. I think probably most of us know those guidelines, though some of them are still changing, and they're adding stuff to the website and updating it constantly. Then look at your state. That is changing a lot every day. Counties, I just talked to an event operator the other day who is out in the Bay Area, and the counties surrounding the Bay Area, each different county has a different set of rules for participation at the moment, which is not uncommon at all, that they're county by county regulations. That's how we are here in Pennsylvania as well. We're following our color system. And then reviewing also if there's potentially rules or rule changes outlined by the state or the NGB as well. So I just was reading last night, the state of Delaware just released some youth sports guidelines. And they actually, it was the first one I'd seen. It was interesting. They explicitly talked about rule changes by sport. So like in lacrosse, there were no face-offs or draws in women's lacrosse. So it was a coin toss, and then you started the game and somebody was 5 yards away. So those are kind of the solutions that you're going to want to talk about with your event operator. Maybe they don't have those rules in Idaho, if that's where you're doing this event, or they don't have them down in Florida, but potentially if you like that idea, that's a good idea. Well, maybe let's get rid of the face-off because you're in somebody's face, you're down, and that's a potential exposure point there. So really thinking about rule changes and trying to make the summer experience even safer. Developing your policy and protocols. So this is one that is an interesting one. So think about your lightning policies that we typically see. So if thunder roars, go indoors. So if we're indoors and we have a large amount of people, now we're all very close inside, maybe that's not the best recommendation for the summer now. Potentially, maybe it's all participants go to their cars individually. So maybe re-examining some of your existing protocols. Another big one that we need to kind of really keep in mind as athletic trainers is there's going to be a major behavioral health component to return to play right now. So it's been a very tough several months. There's been a lot of stress and anxiety, and returning, there's a lot of stress and anxiety. And it's not going to just be on the kids or the patients returning. It's going to be the parents. It's going to be really hard for them to, they're going to be worried about who their child's being exposed to. The coaches themselves might be very stressed about how they're going to be executing or maybe changing the way they coach. So there's going to be a lot of behavioral health components that go into that, and being prepared to handle those situations and understand that it's going to be a very high stress and high anxiety return, and being understanding of that. Another thing to keep in mind too as a clinician is you might be the first person in several months that this child has been this close to. So if this is your patient, they're injured, the only person that maybe touched them or did an evaluation on them or was within 6 feet of this child in the last 3 to 4 months was their parents. So it might be a very alarming experience. So really thinking about the way you evaluate and verbally telling those patients, okay, explaining your evaluation and what you're going to do and what this means. So really thinking about the behavioral health component in your evaluation of all of this pre-event and kind of preparing yourself for these scenarios is definitely something you want to take into account as well. Making sure you purchase supplies. So making sure the event operator purchases them. So you don't want to necessarily show up and be expecting that there's all these extra masks and then you have a potential COVID patient and they didn't actually do it. So making sure you're checking in, be like, hey, just want to make sure you have all the things we talked about, and really kind of rechecking in with your event operator several times. So making sure that they're executing the plan that you guys put together. And then reviewing and developing pre-event communication for participants and staff. So there's going to be a lot of re-coaching of coaching. So think about the way a lot of our coaches coach. They'll just grab the participant's stick and just say, no, you don't want to hold it like this. You want to hold it like this. Where that's a point of contact they need to limit. Really, they're going to have to really work on their visual cueing and their verbal cueing, as opposed to just jumping in and showing them how to do the drill. They're going to have to really think and be able to explain the drill and be able to kind of rework all the drills that they're used to working. So making sure that the staff is trained up as well and understanding what the expectations of the coaches are on the direct guidelines or on the sidelines.
Great, thanks. And again, just from the EO perspective, just for everybody out there listening, athletic trainers, if you don't know, they have their own personal kit, their bag with supplies in it. But when we're talking about supplies, we're talking about PPE, we're talking about other things that you and the athletic trainer have talked about ahead of time. And that's really on the event operator to solve with the athletic trainers and to purchase. If you're going to put on an event, you need to have the right supplies. And that's where you and the athletic trainer need to communicate ahead of time on who's going to be responsible for what do you need. And just my 2 cents as an event operator, this is on us to provide for these athletic trainers.
Hey, Andy, I just want to answer one of the questions that I just saw come up. So having somebody fill out a COVID-19 questionnaire ahead of time. So that is one thing that we haven't said yet, which I think is very important as part of your pre-event communication is please don't come if you're sick or not feeling well or been exposed. We as a society are really bad at that. Americans, we love going to work and not using our sick days and saving them up for something else other than sick days. So I think that that's something that's going to be very hard for us to do. And remembering that this is an opportunity for these kids to come back and see their friends and be involved. So they're going to want to go, but really stressing ahead of time to parents that, hey, if you or your child or somebody in your household is not feeling well or has been exposed, please do not come. So I think there's a lot of strength in pre-event self-assessment and understanding, sending them maybe a checklist of, have you been exposed recently? Have you been feeling any of these symptoms? And really encouraging people, please stay home. Maybe you have a specific refund policy, event operators do, in regards to feeling sick and avoiding an event like that, just so you're not putting everybody else at risk. So I think that's a great question, is really asking people to do the self-assessment ahead of time, and stressing the importance of it, and the responsibility that it really puts on the participants. That's definitely a good idea.
Yeah, and I'm going to have Ellis jump in here on during the event, but again, just from the EO side, it's, and I'm thinking more in terms of a tournament or some sort of recruiting event with lots of participants, lots of fields going. You know, you really need to take in consideration that and know that you're going to need more medical professionals and staff on hand to do all of this. And so I think one of the things that Alice referenced earlier, if you're going to have a COVID coordinator, like at a tournament, that's going to be in addition to what you normally would have in order to help all of the participants. And so I just, one of the things that a question that keeps coming up here is, how do you go and find these COVID coordinators, and like, what would you pay them? And, we'll try to answer a lot of these questions at the end, when we wrap this up. We're only about 4 or 5 more slides left. But Ellis, can you talk about, like, during the event, if you were my COVID coordinator at a tournament, like, how does this apply to that? How does it apply to a camp? And I know we kind of touched on that last week, but it would be good to just kind of dive in there for the athletic trainer population on the webinar.
Yep, absolutely. So managing the execution of the COVID plan. So remember, this is an agreement and a plan that you came up with the event operator. And so it is expected that is executed appropriately. Things happen on game day, and you need to be able to be ready to have some tough conversations with the event operator about, hey, like, we agreed to this, it's on paper, it was sent out, and that's how you potentially as an event operator could get in trouble. So if you're writing a policy, make sure that they're ready to follow it on the day of the event. So if it's temperature screening, for example, and you're doing temporal temperature screens, and your cutoff's 100.4, and it's July, and people are showing up and their skin temperature is much higher, and you're turning away half of the tournament. I mean, that was the policy written. So if you're all of a sudden admitting a bunch of people, the event operator needs to understand you're breaking the written policy that you wrote. So you need to make sure that you're ready to execute the plan, and they need to understand that you're the medical professional here, and that you created this plan and agreed on it together. So again, this is all the stuff that can be addressed in scenarios that you can run through prior to in the pre-event phase, but really sticking to the plan because you created it, you communicated it, and that's really the organization, the framework of how you're going to execute it and run the event that day. State and local compliance, obviously, and documentation if you need it. So some places, it depends, again, county by county, state by state, organization by organization, maybe even insurance companies want you to submit the plan ahead of time for approval. I know a lot of school districts are handling it like that currently, or even universities. They want you to have your COVID plan return to campus or return to school plan written, then you're submitting it to a certain person within the school. It's no different in the sports realm. Again, it's gonna very much change and vary by location, but having the plan ready to go and then submitting it to the people that need to have it documented that, yep, we submitted it to the county of Philadelphia and they approved, and we have it written down. Or if the insurance company wants to see a copy of it ahead of time, then that's something that needs to be sent. And then evaluation and response. So just making sure it's no different than our normal jobs, right? So every patient is the most important patient. The one that you're seeing is the most important patient at the moment. So just giving and creating and maintaining excellent patient care here. I think education is going to be a very patient education is going to be a very important thing. Again, remembering that it's been a long time since we've interacted with strangers, and it's going to be hard to really return to sport and return to normal life, and really understanding that there's going to be a lot of different personalities involved here, that you might have to navigate some difficult situations, and just being kind of ready to respond and openly communicate with all the stakeholders on site.
Yeah, and I think also just, again, the event operator side, if you're doing the stuff pre-event, the enforcing social distancing, encouraging good hygiene, monitoring proper use, and managing, like, everybody at your event should be well-versed on this. And if you have an athletic trainer ahead of time, they can teach your staff, they can teach the coaches on how to all do this. Like, again, this is not all on the athletic trainer or all on the event operator, but it's on the team that we would be able to do this. So again, in my world, we would actually have a 30-minute Zoom meeting like this with Ellis and everybody who was supposed to be involved in the tournament, where she would explain all of this to everybody at the same time. Because again, the key to reopening the sport, the youth sports market, is that people need to feel safe and they need to feel confident that everything is being done to mitigate the transmission of COVID-19. And if that's happening, we'll get back quick. So, all right, Alice, here you go. You're an athletic trainer. What happens if a confirmed positive COVID case at your event? How do you handle that? What's the plan?
Yep, so I kind of talked about it earlier a little bit too, as an athletic trainer, how I'd handle the situation. I think that a big key that you need to really think about is what was communicated to all participants ahead of time about how this situation would be handled. So typically what I'm seeing a lot right now is that there'll be something at the end of the pre-event communication that says, if there is a confirmed positive case, you will be notified of that. And so it's just, it would be a follow-up email from the event operator. Hey, there was a potential positive, there was a potential COVID case at our event where you were. Please follow up with a healthcare professional as needed. As far as reporting that stuff goes, that it would be, from my understanding, it would be the physician, so if they're referred to a physician, and the labs. So if it is a confirmed positive case, the labs are the ones that are going to actually communicating, testing that, and reporting all those numbers. Again, that changes state by state, county by county. As we know, testing numbers and counting is a little bit all over right now. But again, it just kind of changes where you are. But really, it's the communication within all the participants and letting them know that there was a potential exposure at the event. There was one question I saw pop up about water that I wanted to, so what do you think about water supply, changing the spigot on the coolers? So water is a big one. So that's another one you want to think about, like contact audit. So think about how many people push the button. Are you going to, or even when all of our kids put their head underneath the spigot. So if it were me, I would eliminate that. And I would say, bring your own big water jug, and that's your water jug. Or are you going to do, that's another good venue question too ahead of time. So have they turned off the water fountains? Have they turned off the vending machines? What do your participants need to know about going into it? Obviously, some water will need to be available on site, especially in the event of a exertional heat illness. So you're going to need some sort of access to water and be ready to respond. It's the summertime. That's a very potential and likely scenario that you might have to handle. So you want to make sure that there is water available for treating those patients. However, that's a potential contact point of transmission that you could potentially eliminate by having people bring their own giant kind of cooler water bottles ahead of time.
Yeah, no, that's great. And there's a lot of questions coming in, and Ellis and I are going to try to get to all of them at the end here. We're going to kind of wrap up. And obviously, athletic trainers and their skill sets make great COVID coordinators. And Ellis, you are never short on this. So can you explain to all the event operators, and obviously all the athletic trainers out there can be clapping silently for Ellis as she tells this story, but why are athletic trainers great COVID coordinators?
Yeah, I mean, it's interesting because a lot of the guidelines and the recommendations that I've been reading from the state level, from the NGB level, it's a little bit frustrating for me as an athletic trainer because I don't see a lot of athletic trainers actually involved in a lot of these discussion groups. Maybe it's one or two. If you are one and you have been a part of it, awesome, thank you. I love that we are trying to get involved here. There's no reason we should not be involved. This is where we live. This is what we do. Emergency planning, being prepared, and being able to execute the plans that we prepare ahead of time. That's our bread and butter. Prevention is our number one goal all the time. So I think that youth sports are returning and they're happening, and we would be very remiss if we don't have athletic trainers in these conversations and in these planning meetings, because we're the ones that are going to have to end up executing it on the end, or help executing it on the other end. HIPAA training. I mean, we've all been through we love our HIPAA webinars and seminars we have to go to, but it's something we're well versed in. So we understand that how important it is to protect patient information, especially if we're thinking about, a friend of mine is a teacher, and she was saying that in March, prior to this, if a kid coughed in class, there was some bullying around, that you have COVID. So like really, if there is a positive COVID case, making sure that patient anonymity is really respected, because it's not just, obviously it's illegal and you don't want to release that, but think about the social ramifications of this too. We've seen a lot of research too about people that have been diagnosed don't necessarily want to share with other people that they've been diagnosed, because it's kind of a big deal. This has been a very large issue within our country. And so just making sure you're really protecting patient privacy is very important. So evaluation of injury and illness. I put "and" in capital letters there, because a lot of people think of, we tend to, as a profession, get pigeonholed into that musculoskeletal category, or that orthopedic vertical. Which is great. We're very good at our injury evaluations and concussion evaluations and things like that. But illness is another big thing that we see a lot of the time. One thing really quick on the musculoskeletal injuries, what we're going to see too is another reason to have an athletic trainer right now is we're returning to sport. So it's no different than returning to sport after an injury or after anything. A lot of us have been sedentary and sitting inside of our houses and maybe working out on your own, but you haven't really been doing the volume that you've been used to be doing, or been forced to be doing by a coach. So, or been inspired to be doing by a coach. So you're going to see an increase in musculoskeletal injuries or soreness. And it's really important that athletic trainers are involved in that as well. Documentation of injuries and illnesses. So yep, that's something we do. We keep track of all of our patients and all of our patient encounters. So that's going to be something that's very valuable for the event operator here. And stakeholder education and training. Patient education, parent education, it's no different than what we do all the time for teaching parents and teaching the patient about concussions, or teaching them about what their specific injury is. Coaches, think about running CPR training for coaches and other things like that. So, or concussion education. Some of us have had to do that at our high schools. So we are very used to having to get up and explain injuries, risks, and things like that, and educating people about how we create a safer environment and how we're able to maintain a safe environment. So athletic trainers are really the perfect people right now to jump in and help youth sports return in the most appropriate way. Again, there's kind of the old adage, just because you can doesn't mean you should. So really having responsible discussions about how we can, obviously we want to mitigate COVID transmission, but like really, this is a public health issue, and we're in this together, and it is a community issue as well. So it's just because it's good to go in one state doesn't mean that you are in another state. So it's a very specific to the community that you're in, and I think that you need to, as an event operator, you need to respect that, especially if you are a national event operator, understanding that what you did in one state might not work in another, and understanding that you might have to change things on the fly and be ready, because this is a public health issue. And athletic trainers we are very much involved in public health all the time. So I think that athletic trainers are really perfect for this situation and this scenario right now. And we'd be remiss as a profession if we weren't in the room and discussing all of the what if scenarios, because we're going to be the ones on the sidelines that have to walk us through. One more thing too is for athletic trainers right now, we're kind of in this as a team, right? So I encourage everybody to work together right now. So call your athletic trainer down the street at the next secondary school and say, what are you doing? And it's going to be a collaborative effort for us to all work together and really take what's working for you, what's not working for you, what are some scenarios you and your athletic director run through, or you and your event operator. So I think the collaboration is so important right now, so we can really try and get this right, and we can help stop the spread of COVID-19.
Wow. Okay. So basically, athletic trainers are where it's at, and you need to hire them if you want to put on events, camps, any of those things. Great. All right. So I want to get to the questions now. I'm going to try to get as many as I can answered. So big one, multiple people, and I'm going to kind of rapid fire here, Ellis. So you got to help me out. COVID-19 waivers. Again, I cannot stress this enough. You need to go back and watch our first webinar with John Sadler. He strongly suggests COVID-19 waivers, not only for participants, but for parents, for athletic trainers, for coaches, for staff, for everybody, right? Because again, there is an assumption of risk here. So absolutely. And he actually gives you some draft language. However, I will tell you that you need to really talk to your local council about how to pull that off. We're not making any suggestions here, but John Sadler and his blog, he actually talks a lot about COVID-19 waivers and why they're important.
Andy,
Yep, and that's
Andy
really
Ellis,
cool.
this is Chris. We've had a lot of questions come in about the follow-up of different recordings that we've done and webinars. I will be following up with each recording link and presentation slides for all of you to view. And that will be done today via email.
Thank you, Chris.
Hey, so
that's Chris for everybody who didn't know. One more thing I want to add about COVID-19 waivers, and it's one group of people that we didn't really discuss in the stakeholders here, but general counsel. Make sure you get your lawyers involved and have them review the policies and your protocols and your waivers and things like that. Like, lawyers are going to be very important in this return as well. So I think they're absolutely a part of this COVID-19 return team. Absolutely.
Great. So here we go. A couple other questions. How much do you charge for a COVID-19 coordinator? So I'm just going to hit this head on so Ellis doesn't have to respond. I don't know how you can actually put a specific price down without having sort of the needs assessment ahead of time. And if I were an event operator and I wanted to hire Ellis as my COVID coordinator, I would first need to answer a couple questions. What do I really need her to do? Okay, great. And then we need to work out, what that looks like both clinically and non-clinically. The typical rate on Go for Ellis right now is $42 across the nation. That's for an athletic trainer. And for all the event operators that know, they are actually medical professionals. They go to school for a really long time. They sit for their boards. They are medical professionals. And so my feeling is you need to figure out with the athletic trainer what you actually need, and then does that elevate the COVID coordinator? And yes, you absolutely need to pay these people more for their time and their expertise. And if I was an event operator looking to hire someone like Ellis, I would want to know that they have a bunch of experience. They've done event planning, they've done emergency planning, and not just in events, but maybe in their other jobs. And so again, we give the ability at Go for Ellis for you to see resumes and things in the credentialing section of athletic trainers, because we think that's a big part of this conversation. So COVID coordinators, I can't really give you a price. I can tell you what the average for an athletic trainer at Go for Ellis is right now, and just have you as the event operator go through a needs assessment on what you need these athletic trainers to do as your COVID coordinator. Let me see other questions that are coming up here. Okay, for athletic trainers, what if an event operator doesn't want to pay for extra PPE materials? Well, to me, if your protocol and safety plan calls for that, then I probably wouldn't put myself in that situation. Ellis, I don't know how you feel as an athletic trainer, but as an event operator, it is on me to make the environment safe for not only the people that are working the event, but also as safe as can for participants and stakeholders.
Yep, I totally agree. Again, that's one of those conversations we have weeks or even a month or so in advance, saying these are the supplies that we're going to need on site that day, and this will be part of the packing list. And so it's an expectation, and they're constantly being reminded, hey, make sure you have this. Like, it's just as important as having an AED on site right now. Like, we need to make sure we have the proper supplies so we can do our jobs appropriately.
Yeah, another question, as event operator, how does the cost of additional PPE play a factor moving forward? So coming up down the road, I think we will have a full webinar on sort of the business of event operators and how COVID-19 is going to change this, but it's going to change it. You're going to have more expenses as it relates to the health and participant safety and also all the stakeholders that are involved in your event. And so I would absolutely plan for that. Again, I don't think anybody knows when a vaccine or anything is going to come out, but you can pretty much plan for the rest of 2020. You're going to have to take precautions and increase the safety of all of your stakeholders at your events. It's that simple. So I would absolutely assume that you are going to need to spend money on PPE moving forward.
One more thing I want to add too that I think I saw a question about is there's COVID coordinator and planning for COVID, and then there's also pre-event emergency planning. So exertional heat analysis and things like that. So remember, it is important to do kind of a full assessment too of what the event operator already has in place. Do they have an exertional heat illness plan? Do they have AEDs on site? Do they understand what those things are? Do they even know what an emergency action plan is? So really, don't assume that everybody knows everything we do. So making sure that you kind of have that ready to go is being like almost a COVID questionnaire, and then having a second kind of layer of like, this is general emergency planning that you should have and be ready to execute. I think Cardi, we've seen, I think it was the journal, I think it was JAMA, had the article about heart conditions as it related to asymptomatic COVID patients. So that cardiac concerns could be a major issue here as people return to play. So making sure we do have our AEDs on site. I'm seeing a couple other questions about tests and returning to play. Remember, I would have their physician and have it documented the whole way. The physician is going to be the one that's going to really guide them back to play here. And you want to make sure that they're having physician sign off and they're being properly screened prior to returning to play if they have been diagnosed.
Yeah, great. Couple other things that we have about another minute. So the question is, would you recommend that the COVID-19 coordinator be a separate job title and responsibility than the camp athletic trainer, or do you see it as an additional duty an event will take on? So Ellis, I think you would agree with me that we believe that these are probably two separate positions, in part because the COVID-19 coordinator, in theory, will be working ahead of time to pull off some of the protocols and policies that you and the event operator would be putting together. Would you agree with that?
Yeah, and I also think that that's also something you can define within the scope of work ahead of time as well. So what are the expectations and what do you need help doing? So everybody kind of knows what that's going on. But I agree. I think the purpose right now is really to keep an eye on assuming that, we don't want to assume, but assuming that they have all the other emergency planning done, which is why I want to make sure we're emphasizing that we check on that too, but having those conversations ahead of time about really defining what the scope of the project is and understanding where they need help.
No, that's great. Just to see if I can answer one more question.
There's a lot of questions. These are great questions.
There are a lot of questions here. I'm trying to get to one that a lot of people have asked. Okay, so are these procedures going to be included under the EAPP section, or at least recommended? So the EAP, for event operators that don't know, is an emergency action plan. Those are all generated automatically as you post events on Go for Ellis. But there is an opportunity for you to be able to connect with that athletic trainer ahead of time to add to this emergency action plan. And part of these protocols and part of these policies that you're putting together, they will have the ability to be uploaded into the EAP as part of this. So that's a good question. One more here, if we can do this. Okay, so one of the things that, how do you express the need for these plans for EOs and the need for an AT during an event? Well, we have a lot of people on our sales team. Chris is one of those who are out there educating event operators on all of this, because event operators are coming to us and asking, like, what do we do? And our response is, obviously, Ellis, as our chief medical officer, tries to guide them, but it comes down to one simple question. As an event operator, what will happen if I don't have these things in place and something happens? And that, again, is, I'm not a lawyer, I'm not an insurance guy, but that's where you really need to be careful, and why it's important to have medical professionals involved in all of these. And as Elle suggested, you absolutely should get local counsel involved. You should absolutely talk to your local health department yourself with the athletic trainer or the COVID-19 coordinator, because you as an event operator, it's your responsibility to know these things too, because the athletic trainer or the COVID-19 coordinator or any medical professional, it's a team effort. Like, this isn't going to happen with one person. There's too many unknowns. And frankly, there's a lot of different regulations and guidelines out there on how to best prepare your participants and stakeholders for your event. So,
Andy, I have one more thing too on that kind of,
yeah, go ahead.
on that note, is just because the day is over of the event doesn't mean that this process is over. And I think one of the most rewarding things that we used to do when we were, well, we still work together, but when we were running lacrosse tournaments together, and was our postmortem, which is kind of a gruesome name, but it's our after event meeting. So we would all sit down as a group. It would be the tournament director, it would be some of the coaches, and we would all sit down and be very open to criticism and say, this didn't work, or this coach, we had an issue with this team, or the parking was an issue. And so really taking a time and making those mental notes as your event's going on is what if, how can we improve? Remember, your COVID plan is not set in stone. Like, if something didn't work, you need to adjust it. And how can we solve this problem and make it better for our next camp or for the next practice, or address a specific issue with a certain coach? So really making sure that you're taking notes and constantly improving this. Just like our emergency action plans, they change all the time for better. So really working with the event operator afterwards and saying, hey, I think it went pretty well. Here are the things that I think we could have done better. So really making sure that, and maybe the same thing with the event operator. Hey, I think this went well, but I have some ideas about how we could do check-in better or drop off better. So really, I think that remember, just because the event is over, even if you're not running something for another year, you should really take notes and detailed notes about what went well, how can we improve, and how can we move on, and making sure that you're also kind of sharing those with other athletic trainers and maybe other event operators in your area. Like, this seemed to go well for us, and really kind of collaborating with this whole return to youth sport. Remember, this is a community, systemic, national, global pandemic. So we're in this together. So making sure that we're really trying to make the best out of the situation for everybody.
Yeah, and one final thing, the core of this response to getting sports reopened, and you can see now why else, again, we still work together after 10 years, is that there has to be a team approach to this. And I'll give you an example. Event operators need to back their medical professionals at these events, because this is a medical situation, and they're the ones that are trained. And so I always give the example of return to plays when it was concussions and things like that. And at our events and camps and tournaments, Ellis was the queen of that. And there were multiple times where, as the event operator, you have to deal with upset parents, participants, coaches, all of the above, because there was a medical decision made. And as you put all these things together, that's the point here, is that athletic trainers in particular are trained to handle these situations, and they're trained to make the hard medical decisions that, frankly, myself as event operator, I'm not qualified to make them. And so I think as you continue to plan for your events, both as an athletic trainer, as an event operator, the collaboration is what is going to be most important. So listen, we have a ton of extra questions. We're going to get answers out to everybody following this, but I want to thank everybody for their time. I obviously want to thank Ellis. She has the unique experience of being both on the EO and AT side. As Chris suggested, this will all be available to everybody in the next 24 hours, 48 hours, along with the answers to the questions. So thanks again. And I encourage everyone to tune in next week for our tournament reopening strategy. So we've done one on camps. We've talked about the COVID coordinator. And next Wednesday, Elsa and I are going to talk about, okay, if we had to put on a tournament, how would we do it? So tune in. Thank you, everybody. I hope everyone has a great day. Thank you.
Thank you, everyone.